So let's start out with nursing leadership. What do we know about nursing leadership? We know that nursing leadership in healthcare influences positive staff, positive patient, and positive organizational outcomes. We also know that achieving leadership effectiveness and positive outcomes requires a leader to adjust their behaviors to both the work environment as well as staff characteristics. And we know that a nurse's professional identity, who they are, their values, their beliefs, is critical when evaluating nursing leadership and the impact of leadership on a nurse's way of thinking, their actions, and their interactions. So although we know all of this about leadership and the importance of leadership and support of nurses in healthcare, research on nursing leadership predominantly explores hospital settings, and very little has been done in ambulatory care, and specifically for my research in primary care. So I'm hoping to move the needle on that and advance our knowledge of leadership needed in primary care settings. Oops, see, I already screwed up. I missed a click. Okay, here we go. Before we get moving forward, I want to make sure we're all thinking about leadership the same way. You're going to hear me say leadership over and over. It's going to be like the You're going to be able to tick how many times I say leadership throughout today's presentation. So when I say leadership, what am I talking about? For today's presentation, leadership is the formal nursing leaders includes individuals in positions with formal or operational oversight of nurses and responsible for achieving a common goal. Okay, so the key words are the formal and that operational oversight and can influence nurses' work environment. Okay, I'm going backwards. Here we go. Okay, so why is it important that we look at leadership in primary care? I asked that and then I kind of smiled because I know I don't need to sell you all on that. But really, that's really important to ask, right? Why is it important that we have a basis and a foundation and we know what leaders need in primary care? This graphic on the screen is happening everywhere in healthcare, and it serves as a foundation as to why we need to be looking at primary care. Aging populations with increased life expectancy, growing prevalence of multiple chronic conditions is placing strain on healthcare systems around the world, right? Additionally, the growing global attention placed upon addressing determinants of health, including social, economic, and environmental factors, highlight the need to focus on primary healthcare settings. In the United States, the intense pressure on healthcare organizations to reduce costs, improve outcomes, and expand access has led to new care delivery models that are shifting patient care from hospital settings to ambulatory settings. The Agency for Healthcare Research and Quality acknowledges that primary care is the cornerstone of healthcare in the United States and is essential for meeting the goals of providing higher quality care and achieving better health outcomes. Given the environmental changes in healthcare, the function and responsibilities, as you all know, of registered nurses are also evolving. Primary care nurses, with their unique knowledge, their skills, and their central role on primary care teams is key to moving our healthcare system and the health of citizens of the United States forward. In response to the changing models of care and evolving roles of registered nurses, it's critical. It's absolutely critical that we understand the needs of nurses to ensure that our leaders have what they need to be effective, to provide interventions and strategies to support nurses in this setting. Am I behind? Okay. I want to go a little bit deeper in the uniqueness of leadership and nursing practice in this setting and why the difference is notable. So when we talk about leadership and we study leadership in healthcare systems in inpatient settings, for example, that's a very different leadership structure than ambulatory settings. Typically, leadership is conceptualized as a group-level structure, right? A leader overseeing a group of individuals. However, in primary care settings, frequently, there are few nurses reporting to one leader. Or those nurses reporting to a leader may span geographic regions, right? They're not all in one building, in one space with the exact same work environment around them. Therefore, it is important to understand the perception of leadership at an individual level in primary care. Exploring how certain subgroups of nurses with similar individual and work setting characteristics and how they perceive their leaders' behaviors and outcomes could provide us then with a foundation for the development of new models of leadership and effective interventions and strategies to support RNs in this setting. I want to share a quote that highlights another gap that needs to be addressed to ensure that leaders in ambulatory can be successful and drive high quality care. An understanding of nursing practice in primary care. This quote comes from a study conducted by physicians. The physicians in this study were looking at their own work. What do we do on any given day? What are those activities? What hits me here is that through the physicians' work and their research looking at their work, they identified the value and the function of an RN in primary care. Before our practice had an EHR, we employed a registered nurse. After the implementation of the EHR system, much of the work that the nurse performed could be done by other staff who did not have nursing skills, and by 2008, we no longer employed a nurse. However, on the basis of the analysis described here, so the study that they did looking at their work, we have hired a registered nurse to do information triage of incoming laboratory reports, telephone calls, and consultation notes, a completely different job description than what we had before. Nurses, physicians, engineers, etc., we all need to be partnering to continue to advance primary care. AAACN, and so many of you, all of you, I imagine, are doing absolutely incredible work driving nursing practice in ambulatory settings forward and defining the value and the role of an RN in primary care. How many of you have seen Virgin River? Raise your hand. Good. Okay, if you haven't, you need to see it. It's very good. And it's a great representation of an NP in primary care in a very remote setting. The NP moves to this remote town to do work with a physician and support the physician's practice. But what you don't see in the show is the role of a registered nurse. How many hospital shows would you see without the role of an RN? None. The role of an RN and the function of a nurse is so well defined, you wouldn't have a hospital unit or a show highlighting hospital care without a registered nurse. We need to get here in ambulatory care and in primary care, so that one day, how cool will it be that even a show highlighting a remote primary care clinic, there's still an RN in that practice. Perhaps that RN is not on site. Perhaps it's a remote model where that RN is triaging, providing education, offering case management support, care coordination from afar. But that role is so well defined, it's there, and it's spoken about. This headline, we know all too well, right? There's a shortage of primary care physicians and the challenges associated with that. In nursing, there's been incredible work done to show the value of the NP. Just think about it. We've got Virgin River now highlighting that amazing work of an NP in primary care. What about an RN? Going back to that quote that I just read you, those physicians saw the value of an RN. That article was published in the New England Journal of Medicine in 2010, 12 years ago. The work of all of us in this room will continue to advance this conversation and highlight the role of an RN, and leadership is absolutely essential to ensuring the value of that RN is emphasized. All right, on to some workforce data. So let's dig into primary care nurses and what they look like. So to complement this discussion related to what is known and not known about primary care nurses and the support nurses need, I'd like to share with you some workforce data from the state of Wisconsin. As we know, nursing is in a challenging position at the moment, with nurses leaving for many different reasons: burnout, retirement, traveling, and we're working hard to make sure we have a pipeline to fill these positions. As healthcare evolves, it's important to ensure that we have nurses in the right place and at the right time to serve our patients and our communities. As we look at primary care, it's important to know what our current workforce looks like so that we can plan for the future. If we know more about the current workforce, the individual characteristics of our workforce, we can be better informed and make decisions to drive us into the future. In the state of Wisconsin, we are lucky to have a very robust workforce data set. And I'd like to share a bit about the primary care nurses in the state of Wisconsin from this data. The data is from 2018. There is a more current survey of nurses from 2020, but the data that I have that's with this subset is from 2018, but I think it's still very, very meaningful for our discussion today. So first, let me tell you why we have robust data in the state of Wisconsin. We have what's called the Wisconsin Center for Nursing, and it was established in 2005. You can see the mission and strategic priorities of the organization are to ensure that the state of Wisconsin has a workforce to meet the future needs of the citizens. But what's very meaningful is that in Wisconsin, we don't just have WCN, but we also have legislation that requires a workforce survey for every nurse every time they apply for relicensure. So every 2 years, every single nurse in the state of Wisconsin who applies for relicensure is required to take a survey. This survey provides the state with detailed information about the nursing workforce.